I'm Bianca, I'm a registered nurse with Amplar. I did work in the hospital setting for about 5 years. I had my first child and I couldn't do the night duty anymore, and I decided to look for a job where it was going to be a bit more flexible. I was drawn to Amplar for the flexibility, much better work-life balance for me and my kids. What surprised me about working in patients' homes is that you can still attend acute care and tend to all the patients' needs.
So a nurse who'd never thought about community work before would be myself. I've only ever worked in very clinical, highly driven areas. And then it's only that a friend recommended this to me and I thought I'll try it, but I actually love it. I love going and chatting to the patients, finding out about them, seeing how their day is going, what their plans are for the day. It's just little things like that. It just makes that care a bit more personal. So hospital in the home does give you more autonomy with patients because you have that one-to-one contact with them. I don't think people realise the complexity. Anything that can be done in a hospital, to a point, can be done in the patient's home.
Amplar has been very good with the home care because I can stay at home and look after my granddaughters and live in my own home and do what I like to do.
When I was in hospital, the nurses would dress the leg, but I stayed in hospital. Once the nurses have come, it gives me freedom to do things.
Plus the patients are at lesser risk of getting an infection because they're in their own home. They recover quicker because they're surrounded by their family. They feel more safe, more secure, and ultimately they feel in more control. A typical day as a casual nurse myself, I give my availability. I'm then allocated around.
I do love being able to travel around. I travel around the hills a lot, or the Victor. Love to listen to my podcasts. I get a lot of audio books in, sometimes a bit of music.
I do love going around and seeing all the nice coffee shops and nipping in and picking up a nice coffee.
I feel like there's a bit of a misconception about community nurses not being able to provide a high level of care. When you're out in the community, you've got a high level of autonomy. You're on your own, so you've got to think on your feet and make sure you're providing a good level of care.
The support that Amplar Health offer, we have teams, so if ever we're struggling, we can hop on Teams and ask somebody a question. We can ring another nurse, and that's good because sometimes you haven't got the answer, but somebody can help you. And if we're stuck and no nurses can help who are currently on the road, we can call our clinical coordinators and they can help us as well.
So all of our training is done in-house, supporting staff as they come through as new staff members, but then also continuing that support as their journey with Amplar continues in terms of upskilling them to new skills they haven't done before, supporting them out on road till they feel comfortable and competent with those skills. I also help to support them to have the flexibility in their roles that they're looking for to help get that work-life balance for all of our staff. So it's all done as part of working for Amplar Health within your work hours.
I can see how much this means to patients with the care that we deliver. Often people are surprised that they can get the care in their home.
I do like the home environment. I never thought that I would, but I do like seeing patients in their actual home environment because you do get to see the person as they are, not as they expect they should behave in a hospital.
If you're interested in joining this mission and want to learn more, reach out to someone from our team or jump in the app and take a look for yourself.